On one of the weekly afternoons I volunteered at a family service agency, I was asked to see Teresa. She was neat, clean, and attractive, despite the fact that she was overweight. What impressed me when she came in was her total lack of energy, as if the act of coming to see me was an overwhelming effort. Teresa appeared about as depressed as any woman I've ever seen. From my experience with many women like Teresa, I knew that right from the start I had to avoid getting trapped into what I was sure would be a story of rejection, self-pity, and hopelessness. I was determined not to ask Teresa to tell me her story, and especially not to ask her how she felt. I had to try to convince her that she was making ineffective choices in her life, knowing full well that my claim that she was making choices, especially choosing to depress, would be the furthest thing from her mind. If I couldn't begin to convince her on her first visit, there was little chance of any measurable progress. I started by rising briskly, greeting her warmly, and offering my hand. Teresa was surprised by my energy and enthusiasm to see her. I was not the first therapist she had seen, and she was used to using her depressing to take over the interview, and if she could, immediately strip it of all hope. With a puzzled look on her face, she shook my hand limply and then sat down and just looked at me. "Teresa, I'm glad you're here. Did you have any trouble getting an appointment?" I could see that she didn't expect that question. She expected to tell me her tale of woe with many insertions of how awful she felt. It took her a while to shift gears, but I just smiled and waited.
No, not really. I had to wait for 3 weeks, but Janet, my social worker, told me it wouldn't be any longer than that.
I knew Janet. When she asked me to see her, she told me Teresa was very depressed. Janet was at her wit's end to know what to do with her. She wanted to tell me more, but she knew me well enough to know that I don't want any history or information about the people I see before I see them. Janet is trying to learn choice theory, but the idea that we choose all we do is a struggle for her. Was Janet polite to you when she talked to you about seeing me? Is she usually considerate when she sees you? I knew Janet was always kind and considerate, or I wouldn't have asked that question, but from Teresa's standpoint, it was an unusual show of interest on my part, and I could see her brighten perceptibly. I know you've been here only a moment, but do I seem polite and concerned so far?
Yes, you seem fine.
Now I had her attention. Her depressing was diminishing in front of my eyes. Teresa, therapy is not easy. I have to ask you some hard questions that may even confuse you a little, but I'm doing it because I want very much to help you. But please, if I say anything that you don't think is right, ask me why, and I'll explain as well as I can. This really isn't a hard question, but I'd like you to try to do your best to answer it. What do you think a psychiatrist can do for you? I want her to have some expectations, not just to sit there and accept that not much can be done. This question will help her to learn that everything we do is important, that if she works with me, she can get some help. She answered as I thought she would. That was what was important.
Help me to feel better. I feel so depressed. I have no energy. My life is a disaster. Look at me. The only thing I enjoy is eating.
Fine. That's the answer I was hoping for. You think you can use some help. You haven't given up. I reframed her hopeless answer into a hopeful one. Teresa ratcheted up her interest another notch, and I continued. Now I'm going to ask you a question that may not make much sense. Are you willing to try to answer it?
You're the doctor. Ask me and I'll try to answer.
Is it okay if we don't talk at all about how you feel or about your life? You said it was a disaster. I'd just as soon not talk about it.
I don't understand. When I've talked to other therapists, that's all they want to talk about. That's what I've been telling Janet. I thought that's why she sent me to you. My God, with a life like mine, what else is there to talk about?
Please, Teresa, tell me, has it done any good to talk about your misery to anyone? Like, do you choose to feel better after telling someone how miserable you are? I'm indirectly introducing the idea that she can choose to feel better. I wonder if she'll pick up on it. She didn't.
Wait a second, you're getting me confused. I've got to tell you how I feel. How can you help me if you don't know how I feel?
Teresa, you don't have to tell me how you feel. I know how you feel. Janet knows how you feel. I'm sure everyone you know knows how you feel. Now I'll come right out with the idea that she's choosing how she feels. She won't be able to miss it this time. Everyone who comes in here is choosing to feel bad. No one who chooses to feel good ever comes in. At least they've never come to see me. I don't think it's a very good choice. That's why I don't want to talk about it.
I don't know what you're talking about. I don't choose to feel bad.
Well, if you don't choose to feel bad, then how come you feel bad?
I feel bad because my life is a disaster. What else could I feel?
But does choosing to feel bad help you in any way to feel better? I realize I'm confusing you, but I'm trying to help you. How you feel is a part of the way you choose to live your life. You chose what you did all day yesterday. Did you feel good or bad yesterday? I use this technique of looking at yesterday a lot with clients like Teresa who think that they are already doomed to a life of misery. If we look at her life as a whole so far, it probably is hopeless, but if we look back only as far as yesterday, there's a lot of hope. Hope is what I'm working toward. Teresa then gave me the standard answer that too many people who are choosing to depress believe.
But several doctors have told me I'm suffering from depression, clinical depression they call it. It's a mental illness. I can't just choose not to be depressed. Are you really a psychiatrist?
Have any of the psychiatrists who've told you you're mentally ill talked to you and helped you?
They gave me medication. It helped me feel better for a while, but it doesn't seem to work anymore. That's why I asked Janet if I could see you.
Medication for depression, which does make people feel better, works best with people who have much more going for them in their lives than Teresa has. But in my experience, therapy works as well or better with these same people. I don't plan to offer you medication. I want to talk with you. I want to help you make better choices in your life starting right now. Has anyone ever talked to you about the choices you make, like I'm doing now?
No, not really. Mostly they just talk about my problems, what I'm doing with my kids, how I budget my money, my weight, things like that. I don't think anyone's ever mentioned choices. You're the first one to talk like this.
Okay, tell me, how do you feel right now? I mean, this minute.
I feel a little angry. I think you're playing games with me.
At this point, I got very serious. She could see how important what we were talking about was to me. Is feeling a little angry better than how you felt when you walked in? Think about how you feel now and how you felt a few minutes ago when you walked in the door. Let's say hello again. Here, give my hand a good shake. I reach out my hand and she gives it a much more vigorous shake than she did when she came in.
Okay, you're right. I feel a little better. I do.
Aren't you choosing to feel better? You could have chosen to continue to feel the way you did when you came in. If you were suffering from clinical depression, how could you feel better all of a sudden?
I don't know. I don't feel bad all the time. Besides, I don't want to feel bad. I feel better with you.
Labor the point, but you chose to stop feeling bad and you're choosing to feel better with me.
Okay, I'm choosing to feel better for a few minutes. What good is that going to do me for the rest of my life?
Would you like to stop choosing to feel better and go back to choosing to feel bad? You can do it right now if you want to. I believe you're an expert in choosing to feel bad.
Oh, so you claim all I have to do for the rest of my life is choose to feel good and everything will be fine. Are you kidding?
Okay, it may seem that I am, but I'm really not. Follow along with me. I said some of these questions would be puzzling. Tell me, why are you choosing to feel a little better right now?
I don't know. Maybe because you got me thinking a little. I'd about given up on thinking.
I got the impression that you'd about given up on everything.
You can say that again.
When you give up on your life, what is it that you really give up on? Think a minute. If you can answer that question, I think you can really get some help.
But if I can't answer it, I can't get any help?
Oh my goodness, no. I'll help you answer it, but don't be surprised if you find it hard to answer. I don't think very many people can answer it. It may help if you think about the way you've chosen to be for the past 2 years since you've been coming to this agency.